Good afternoon, everyone, and welcome to today's SHRN webinar. My name is Abby Rowe, and today I'm going to be sharing some insights from my PhD research, which I conducted over the last 3 years, that aim to understand how secondary school contexts can best support the mental health and well-being of students with ADHD. So just a little bit about me before we get started. I have previous experience working in secondary schools as both a teaching assistant and a secondary school teacher. I then worked for Mind, the mental health charity, as a project coordinator, delivering a whole school approach to mental health project in secondary schools across Wales. I then moved into this research PhD, which was very kindly funded by the Wolfson Centre for Young People's Mental Health. I'm going to start by giving a bit of background about my project, which includes an overview of ADHD and then also some of the school-related literature that helped to inform my research project. I'm then going to talk through each of the 3 studies individually, the first 2 of which very much use the SHRN data, and the third one which was informed by the findings from the first 2 studies. I'm then going to talk through some recommendations that came out of this project, and I'll go into more detail about that when we get to the slide. So let's talk a little bit about ADHD. This stands for Attention Deficit Hyperactivity Disorder, and it's a neurodevelopmental condition. So this refers to a group of disorders that usually begin in childhood and that affect the development and functioning of the brain. ADHD is also characterised by symptoms of hyperactivity, inattention and impulsivity, and these symptoms lie on a spectrum, meaning that ADHD can look and feel very different for different individuals. ADHD is also more commonly diagnosed in males than females, and research is currently looking into sex differences in the presentation of ADHD symptoms. The child and adolescent estimated global prevalence of ADHD is around 5%, whereas actually the most recent recorded diagnosis in Wales shows a prevalence of around 1.4%. And this is interesting because there's a common misconception that ADHD is being overdiagnosed, when actually this points towards a possible underdiagnosis in Wales. Regards to the diagnostic process, this requires multiple informants across multiple settings, and this actually tends to use parents, carers and teachers as informants, and in terms of across multiple settings tends to be at home and within schools. And you also require evidence of impairment, meaning that symptoms are actually interfering with the daily functioning and quality of life of the individual as well. But what do we know about adolescents with ADHD? Well, we know that they're more likely to develop mental health problems, including anxiety and depression, than their peers. We also know that they're more likely to experience school-related challenges, including lower attainment and increased exclusions than their peers. But actually, little is known about how secondary schools impact on the mental health of adolescents with ADHD. Interestingly, the COVID-19 pandemic brought forward some interesting insights. In contrast to the general increase in mental health problems observed in young people during and since the pandemic, a 2021 study by Creswell et al. Found that during school closures, some pupils with additional learning needs and neurodevelopmental conditions, including ADHD, experienced a decrease in emotional and behavioural difficulties. This could suggest that not attending school actually improved the mental health of this group. I therefore became interested in understanding if this was true, and if so, what specific aspects of secondary school life were impacting on the mental health of adolescents with ADHD. So this became the core aim of my research project, bringing together these 3 subject areas: secondary schools, mental health, and adolescents with ADHD. So I was really hoping to understand the role of secondary school contexts, including school practices, school policies, and school climate in supporting the mental health and well-being of adolescents with ADHD. So starting at the beginning with study 1, I wanted to understand, is there a difference between schools in the mental health and well-being of adolescents with ADHD? And the reason this was important was to understand if school contexts are actually important to the mental health and well-being of this group. So let's visualise this. When we look at these 6 schools, there are a few different ways a pattern of mental health could look. We might see that most schools have similar levels of student mental health, with just one school standing out as having better or worse student mental health, or we might see that every school looks completely different, or even that they're all almost identical. Each of these patterns tells us something different about how much the school environment itself is shaping students' well-being. Multi-level modelling, which was the analysis used in this study, helped us work out whether the differences we see are mainly coming from individual students themselves, or whether the school context itself is contributing to those differences. And this helps us to understand how much schools actually contribute to the mental health of students with ADHD. So this is where SHRN comes in and is such a fantastic resource for researchers looking to understand and support schools. Although I conducted my research in 2022, I actually used the 2019 data, and this is for two reasons. It was the first year that two new mental health and wellbeing measures were introduced in the survey, and it was also not a year that was impacted by the COVID-19 pandemic. I also used only the data from year nines, and this was because they already have 2 years of school experience, so their responses were less likely to be related to the transition into secondary school, and they also haven't yet reached the full exam period, so results wouldn't be swayed by this either. And finally, because focusing on just one year group actually made the analysis a lot less complicated. I ended up with 24,375 students' data from 198 secondary schools across Wales, and to the right there are just a few more details about the schools that were involved for your interest. So the first set of questions from the SHRN survey that I was interested in were related to mental health and well-being, and that included 7 questions related to well-being, 13 questions related to depressive symptoms, and 5 questions related to emotional difficulties, each of which come from their own individual validated scales. For the well-being measure, higher scores actually equal better well-being, whereas for the other 2 measures, higher scores equal more reported problems. Now remember, I was most interested in the differences in these mental health measures for individuals with ADHD, but the SHRN survey doesn't have a question asking students about their ADHD status. The survey does, however, include the Strengths and Difficulties questionnaire that includes 5 questions related to symptoms of hyperactivity and inattention. This is known as the SDQ-HI subscale and is scored between 0 and 10. Students are asked to rate how often they experience each statement question, with higher scores meaning students experience related symptoms more frequently. Using the measure's recommended guidelines, I then created a proxy ADHD measure that aimed to represent those most likely to have symptoms consistent with ADHD, based on those that scored 8 or higher. Anyone scoring 7 or lower was assigned to the non-ADHD group. And for my second study, I looked into the accuracy of these groupings to correctly identify those with ADHD, which I will summarise a little bit later. So I'm going to jump straight to the results now. There is a little note at the top here about the analysis that was used, which I mentioned earlier, called multi-level modelling and intra-class correlation coefficients, which essentially is trying to help you to understand how much of the difference in students' mental health and well-being is due to the school they attend or to the individual student factors. And I used the previous measures to determine this using that analysis. And if anyone has any questions about this that they want to contact me about, please feel free to do that towards the end. But regarding the results, what we actually found was that the ADHD group consisted of 15% of the total sample, and a higher proportion of females than males were in that group. And that's in contrast to actually the previously mentioned prevalence rate, which is around 1.4 or up to 5%. So it's a lot higher and actually included a lot more females than expected. Secondly, we also found that the ADHD group was associated with poorer self-related mental health and well-being measures for all of the 3 measures that were included. And this was consistent with what we expected to find in the ADHD group, who are known to have poorer mental health than their peers. Then finally, the students' mental health and wellbeing scores did not actually vary much between schools for both the ADHD groups and the non-ADHD groups separately. So this actually brings up a few questions. The first could be, are schools consistently supportive or consistently challenging to students' mental health and wellbeing? And that's not something we can actually tell from this kind of analysis. The next question is, what, if any, school factors are actually impacting on the mental health and wellbeing of students with ADHD, who we know have poorer mental health and wellbeing than their peers? So although we found that there wasn't very much variation between schools in the mental health and wellbeing of these groups, that's still an interesting finding. It's this consistency alongside the poorer mental health and wellbeing for the ADHD group that I was now interested in learning a little bit more about through follow-up analysis. So to follow on from this, I first wanted to understand a little bit more about how well that proxy ADHD measure, or the SDQ-HI, actually identifies students with an ADHD diagnosis. And that's what I did for study 2, which I'll summarise in just a second. Secondly, I then actually wanted to understand more about these between school variations. So if actually the practices between or across schools are very similar, I wanted to understand more about what it is about those schools or the contextual factors within schools that are impacting on the mental health and wellbeing of students with ADHD, if they are. And also then, are those practices similar or different between schools? And that's what I did for study 3, which I'll cover in a bit of time. So for study 2, I was trying to understand the SDQHI a little bit better, and for this I needed to link the SHRN data to ADHD diagnosis records. I did this using the SAIL Databank, which is a nationwide repository of routinely collected data in Wales, including healthcare data, education and demographics records. Through this databank, I was able to link students' SHRN data to ADHD diagnosis records. This meant that for all students who completed the SDQHI questions and agreed to data linkage, I also knew which students actually had a recorded diagnosis of ADHD. For this study, I included all consenting 11 to 16-year-olds, which resulted in 23,367 students' data from 138 participating schools. This was the first study to ever link SHRN data with SAIL ADHD diagnosis data. To summarise the findings, firstly, we found that 1.8% of students had a recorded ADHD diagnosis. But of these students, only 40% of students with an ADHD diagnosis scored 8 or above, so in the higher category of the SDQHI, which I previously determined as the ADHD group. This means that 60% actually scored in the lower category. So this indicates that the cutoff of 8 or above using the SDQHI is probably not a great indicator of ADHD diagnosis in a community sample. But what does this mean in practice? Well, actually, it means that you should probably use caution when interpreting your school's SDQHI scores. This is simply because the very high scores do not necessarily equal to an ADHD diagnosis. But what it is telling us is what students are self-reporting. So people in the high category are self-reporting ADHD-related symptoms, and people in the lower category are not reporting as many ADHD-related symptoms. And this is still an important trend to consider relating to your own school's population, even if it doesn't necessarily equate to a diagnosis. While there's more depth to these findings than I have the time to go into, I will welcome any questions at the end of this webinar, and know that there is much more research required to better understand the SDQHI. So let's think back to study 1 that found that all of the schools in the study each had a similar impact on the mental health and well-being of students with ADHD, though it couldn't tell us whether this influence was positive, negative, strong or weak. And this brings us on to study 3, which aimed to understand these possible contextual school influences in more depth. In the qualitative study of study 3, the main research question therefore asked, how do students and staff describe the challenges and benefits that aspects of school climate pose for the mental health and well-being of adolescents with ADHD? The reason the term school climate was chosen as the focus was thanks to public participation from neurodivergent school students, staff, and other educational professionals that I consulted with prior to this study. They shared their thoughts about what areas of school life I should focus on, but actually gave quite a broad spectrum of responses. School climate refers to the overall quality, character, and feel of a school environment, encompassing shared experiences and perceptions related to school values, teaching, relationships, policies, and safety, all of which were highlighted in the consultations as areas of school life that could impact on the mental health and well-being of students with ADHD, and this therefore became the focus of my study. This study placed high importance on the voices and experiences of students and school staff who are truly the experts. I conducted one-to-one interviews with all of the participants, with questions focusing on people's own school experiences, how they think students with ADHD experience school, and what they know about ADHD, neurodiversity, and inclusion at school. The questions focused on experiences related to aspects of school climate, including school values and relationships, but I was open to anything related to school contextual influences that people wanted to share. I also recruited from 3 secondary schools in Wales, and I used the SHRN data to support this by ranking schools in order of their students' mean mental health scores, using the same 3 measures I mentioned earlier. I created 3 groups of schools, high, medium and low wellbeing, and anonymously chose 1 school from each category to take part. I was not aware of what school I attended was from which category, but this process aimed to include schools with varied mental health and wellbeing experiences. In total, I recruited 30 students, 10 from each school, from a broad range of profiles, including different genders, levels of attainment, and those with or without ADHD. I also recruited 15 staff members from a range of school roles. I did not choose to focus these interviews solely on the experiences of those with ADHD, as I was interested in the broader school understanding of ADHD. I also did not want to exclude individuals who identify as having ADHD or related experiences, but who do not yet have a diagnosis for whatever reason. In the end, 2 students and 3 members of staff actually voluntarily shared that they had a diagnosis of ADHD, and a further 10 shared that they had traits related to ADHD. Quite a few others also shared that they had friends or family or knew a person with ADHD too, and I had a good spread of males and females. The analysis that I used to code and organise the interview transcripts into themes and sub-themes was called reflexive thematic analysis, and I would be happy to talk more about this later should people have questions. The reflexive thematic analysis led to 3 core themes and multiple sub-themes that were developed from the incredibly open, insightful and detailed responses the participants shared in their interviews. Each theme describes a way in which schools can be seen as directly influencing the mental health and well-being of students with ADHD. And I'm now going to explore each theme in more detail, sharing some participant quotes and summarising the findings, starting with theme 1, the systemic mismatch between ADHD and school expectations. So this theme largely relates to ways that the design of school contexts misalign with the inherent traits of students with ADHD. The first theme describes this mismatch in relation to the behavioural expectations and behaviour systems. So participants shared that behavioural expectations like sitting still and sustaining attention for prolonged periods of time conflict with the innate traits of students with ADHD, which often tend to struggle with those kind of attributes. These expectations often led to negative feedback, sanctions, and emotional distress for these students, and behaviour systems were often seen as unfairly punitive for students with ADHD too. A member of staff shared, a lot of the time their behaviours and their reactions are seen as, against our behaviour policy and really naughty and really disruptive. In the second theme, participants had recognised the mismatch related to academic pressure and standardisation. They shared that standardised workloads and exam pressure are challenging for all, but probably more for those with ADHD, that students with ADHD often feel demoralised when their efforts don't match the expectations, and that a lack of differentiated teaching methods often hindered learning and self-esteem, though when these were in place, that would often have positive impacts. One student shared, "I just feel really, really down because I couldn't get those grades that they were expecting me to get." This third sub-theme was related to navigating the structure of the school day, and participants shared that those with ADHD often found that long, rigidly structured school days with limited breaks were challenging. Students with ADHD need more frequent movement and regulation opportunities, and the repetitive cycle of navigating the school day leads to greater emotional consequences for students with ADHD. A student shared, "Just doing the same thing, sat every day, 6 hours every year, it's just not nice. I spend my weeks waiting for the weekend and I spend my weekends dreading the week, and it's just that cycle, if you know what I mean." In the fourth sub-theme, it related to curriculum relevance and engagement, where students struggled to engage in subjects they find irrelevant or uninteresting, and this was related to majority of students, but also more specifically to those with ADHD again. There are limited subjects and learning approaches available that engage students with ADHD, and that practical and vocational subjects options are limited for all. A member of staff shared, "A complete overhaul needs to be done for something that they're interested in and make them feel better about themselves and that they're succeeding, So it was more about the strengths-based approach to try and engage those students. So that was a summary of theme 1. I'm now going to move on to theme 2, which was about relational understanding and misunderstanding. And this is where participants highlighted the quality of student-staff relationships and various ways that students with ADHD feel misunderstood or understood in the school context. They also then talked about the emotional consequences and the emotional benefits of feeling understood or misunderstood. So for sub-theme 1, quality of student-staff relationships, participants believe that positive relationships with staff and peers are crucial for the engagement and well-being of students with ADHD. They also believe that students value teachers who show care and encouragement. And a student shared that, "If I was a student with ADHD, I would love to have really good relationships with all the teachers being nice, because school's never going to be easy." For sub-theme 2, feeling misunderstood or understood in the school context, participants shared that students with ADHD are more likely to feel misunderstood by school staff. Misunderstanding is linked to lack of knowledge, reduced empathy, and unhelpful attitudes and behaviours, and the degree of misunderstanding varied between students and staff within schools. A member of the student population shared, sometimes it can be difficult because it's hard to concentrate and then some of the teachers don't understand why. Subtheme 3 and 4 both relate to the emotional impacts of understanding. Participants shared in Subtheme 3 that misunderstanding leads to a range of consequences, including stress, shame, and withdrawal from learning. They also felt that some students and staff hide their ADHD diagnosis due to stigma, which was actually directly shared by students with ADHD and teachers with ADHD within these interviews. They also found that peer misunderstanding can result in bullying or provocation. One student shared, "I know that most people with ADHD do keep it quiet and it is a bit sad because why should you be ashamed of it?" In Subtheme 4, they shared that feeling understood improves attendance, engagement, and self-esteem for all students. Students and staff with ADHD or personal experience are often more empathetic, and restorative practices can help rebuild relationships and understanding. A student shared, "My friends support me with it and they know what's going on, which is really good. I love the fact now in PE people will laugh with me instead of at me." Okay, now moving on to the final theme, which was about the mental health and well-being impacts of systemic and structural inclusive practices. Again, there are 4 sub-themes that I'll go into in more detail now. So the first sub-theme in this category was related to staff knowledge and training gaps. It was suggested that staff and students' ADHD knowledge varies widely and is often felt to be insufficient in schools. ADHD and neurodiversity training is also not mandatory in all schools, and knowledge acquisition is often left to individual initiative, so each individual staff member has to take it upon themselves usually to find the information that they need. There was also a desire for practical, accessible, and empathy-focused training that creates a culture of acceptance in schools. One member of staff shared, "I do think the understanding is a lot better than it has been over, the years, but I think ADHD, there's some way to go." For Subtheme 2, this was about flexible approaches and also inconsistencies in approaches across schools. It was found that flexible approaches to school systems and expectations are important for students with ADHD, but successive implementation varies within and between schools. ALN or additional learning needs departments deliver flexible approaches very well. It was also suggested that inconsistent approaches are impactful, such as where flexible support is undermined by rigid systems. A neurodiversity paradigm approach, which is one that suggests the school environment should be tailored to meet the needs of the individual rather than focusing on the individual changing their behaviours to meet the needs of the school, was widely accepted but perceived as challenging to implement. One student shared, we could do something in one lesson and be completely fine, and then do it in another lesson and then get into tons of trouble for it. I feel like all teachers need to be on the same wavelength. And this was again related to those inconsistencies and the impact of those on students' mental health. For the third sub-theme, capacity, resource, and time constraints, it was felt that staff face time and workload pressures that limit their ability to effectively support students with ADHD. It was also felt that funding cuts reduce access to invaluable resources and external support services, with some staff using personal funds to actually fill these gaps. A staff member shared, "Wouldn't it be incredible if we could give these ADHD children even more support and even more tailored timetables and what have you? We can't do it. We don't have the time." For Subtheme 4, additional needs documentation and needs versus diagnosis-led systems, it was believed that one-page profiles and independent development plans are inconsistently used or ignored, which is frustrating for students with ADHD, and that a lack of diagnosis can limit access to school-based support in some cases. It was also felt that bureaucratic delays often hindered timely interventions, and this was frustrating for all. One member of staff shared, "There may be caught in this area where they haven't properly been diagnosed, so they're not getting the proper support." Now, I appreciate that that was just a whistle-stop tour of the 3 themes and sub-themes that came out of this study, and I could talk about this for days, so please feel free to ask questions towards the end of this webinar if you have any, or to contact me at any time. But to summarise, there are multiple aspects of secondary school context that it seems are perceived and experienced to impact directly on the mental health and well-being of students with ADHD, and this is from the perspective of all of the students and staff that took part in this study. There was also reportedly more variation in the reported practice within schools than between them. So this actually takes us back to study 1 that found something similar in that the impact of mental health and well-being of schools on students with ADHD is likely consistent across schools, even if it's inconsistent within schools, as was reported in this study. Now, although I had a fantastic range of students and staff that gave some really valuable information in this study, there were only 3 schools that took part in this out of the over 200 secondary schools there are in Wales. So more research is definitely needed to support the translation of these findings into practice. But given that there was so much fantastic data that came out of this, I took it upon myself to generate some recommendations in consultation with some more students and staff and educational professionals that I worked with throughout this project. And I'm now going to talk you through those recommendations. Now, before I talk through the 10 recommendations that resulted from these 3 studies, I want to just state the following. Firstly, that these were developed directly from the findings of this study and therefore from the voices of students and staff with direct secondary school experiences. Secondly, that I'm aware that some are likely easier than others to implement, that some require others to be implemented before they could even be considered, and that who they could be completed by differs from point to point. The idea of developing these was to give food for thought for individuals, SLT members, school policy makers and funders, and also researchers, so that we can all consider potential areas of change that could impact on the mental health and well-being of students with ADHD. It's also important to note that from the findings and further consultations with study collaborators, it was felt that while these recommendations have the potential to meaningfully support students with ADHD, they equally could benefit the wider population too, or at the very least were not thought to result in any consequences for this population. Okay, so the first recommendation is about developing a map of contextual school influences to help guide improvements. This could be some kind of visualization of the findings that I've shared and development of further findings that concisely link specific areas of school context to mental health and wellbeing outcomes for students with ADHD. Something like this could support researchers to more thoroughly test these mechanisms and could also help schools to identify and understand the impacts of their environments in order to direct their time and resources in the best way that they can. The second recommendation is about high quality training and resources, and this is for both students and staff. It could be related to ADHD, but also to neurodiversity in general. And also it could be about developing empathy and strength-based approaches within schools to support the acceptance and thriving of everyone who may be considered different. These should be openly available or could be mandatory for all schools to support more consistent understanding. The third recommendation relates to optimising the implementation of support and of relational strategies. It could be that funding is required before this is possible, or perhaps that schools could simply consider how their current best practices related to support for students with ADHD could be more consistently implemented across their schools, taking the lead from those with lived experience. The fourth recommendation is about rethinking behaviour management systems. This would have the main aim of reducing unfair practices related to the mismatch between rigid school expectations and the knowledge that the inherent traits of individuals with ADHD and other neurodivergent conditions do not always align with these expectations. This could require the development of national guidance or begin from schools' consideration of their own behaviour policies and the potential impacts of the implementation of these on certain students. The fifth recommendation is about rethinking the structure of the school day. While this is likely one of the more challenging recommendations to consider, it may be that rather than a whole school scheduling restructure, there is more consideration of structured flexibility across the school day, including scheduled breaks for all, to especially benefit those who need them the most. The sixth recommendation involves the diversification of the curriculum and of teaching and assessment methods. I know that the implementation of the new curriculum for Wales is currently ongoing, and it may be that we soon start to see the benefits of this for students with ADHD, particularly given that mental health and well-being is embedded as an area of learning and experience. But perhaps more consideration could be given to the development of neuro-inclusive teaching practices, for example in teacher training programs, and also of neuro-inclusive assessment methods that consider individuals' strengths and learning needs. The seventh recommendation relates to strengthening evidence for a universal neurodiversity-informed culture. This would involve bringing together and developing new research, knowledge, and high-quality, impactful interventions to create guidance for the development of neurodiversity-informed culture change in mainstream secondary schools. This is a broad recommendation, but accounts for the need for dedicated new research and a pooling of knowledge and resources to create a sustainable behaviour and attitude shift so that schools can effectively support their neurodiverse communities. Recommendation 8 is about protecting and prioritising funding for schools. There's little more that I can add to this, but it is important to highlight that the reduction of school-based funding and resources was perceived to be directly linked to barriers for supporting the mental health and well-being of students with ADHD and the entire student body. With capacity and resource, schools will have the space to use their expertise and creativity of practices in the most meaningful way possible. Recommendation 9 is about developing robust ADHD research assessment tools. For researchers, this could involve understanding more about what screening tools such as the SDQ-HI are measuring, so that communities who use these measures, such as within the SHRN survey, best understand what their schools' results are truly telling them. And the final recommendation is about improving ADHD diagnosis pathways. This again may require more funding to both healthcare settings and schools who are supporting these diagnostic pathways, but ultimately if students are receiving earlier diagnoses, they will have access to support much earlier, whether this is through medication, schools-based interventions, or simply improved self-awareness and knowledge of their own strengths and needs that could help them to navigate their school lives. So that brings us to the end of today's webinar. I can't thank you enough for attending. I hope this has been an insightful presentation and that you've come away with something to think about. I've managed to cover the 3 research studies I conducted as part of my PhD project, including how the SHRN data was used to inform these studies, and I've summarised the key findings which have essentially uncovered some specific mechanisms linking school contextual factors with mental health outcomes for adolescents with ADHD. And I think this is just something that we can't ignore, and hopefully we can work together to really make some meaningful change to school context to reduce mental health inequalities for students with ADHD. I could honestly talk about this for days, and there was lots of detail I simply didn't have the time to include today, so please do contact me with any questions at any time using the contact details on the slide. Thank you so much for attending today.